that vaccines for the coronavirus pandemic will be provided at a free of cost charge across India. His announcement comes as India is holding a nationwide drill on the vaccination process today. According to sources, India is likely to give a nod to Oxford AstraZeneca's vaccine candidate over the course of the next few days. So this is the big breaking development that has come in, where Dr Harshvardhan has said that the vaccines for coronavirus will be provided to all Indians free of cost.
वैक्सीन जो है वो फ्री होगी लोगों के लिए या उन्हें कीमत देनी पड़ेगी? दिल्ली में ज्यादा फ्री है, दिल्ली में नहीं सारे देश में फ्री.
All right, so that was Dr Harshvardhan there saying Delhi mein nahi, sare desh mein free hogi, essentially saying that the vaccine for coronavirus in India, which has a population of almost about 1.4 billion people, will be provided free of charge. And to get us more insights into this, we are joined in by WION's Siddhant Sibal, who's joining us live on this broadcast. Hello, Siddhant. This, of course, is an important announcement that the Health Minister of India has made, where he stated that vaccine for the coronavirus will be provided free of charge for all Indians.
Well, yes, Mohammed, a big announcement that the vaccine will be free for everyone. That's a big announcement. I'm standing at the GTB hospital where, of course, he made the remark a short while ago. We know that is one of the places where the dry run is underway. In fact, India is taking the dry run, the all India dry run across various states of the country. And big focus is to learn if there are any gaps when it comes to vaccination drive. So basically what is happening here behind me in this building is that dummy vaccines are being given, and it is being understood how the process will take place. Basically there will be 3 rooms. It will be the waiting room, then of course the vaccination room and the observation room. In the vaccination room there will be a refrigerator where the vaccine will be kept, and in the observation room basically you will be kept for 30 minutes to understand if there are any negative reactions to the vaccine. In fact, now the big focus is a formal approval to the vaccines which are in the fray. In fact, what sources are saying that the subject expert group has given an approval to Covishield, the AstraZeneca and Oxford vaccine. But now what is awaited is the formal approval by the drug regulator. Once the drug regulator of India gives an approval, then that vaccine can be used. What is being understood is that India might start the massive vaccination program across the country as soon as next week.
Absolutely, indeed. That's an important and a significant announcement, Siddhant, and also something that a lot of people across India had been waiting for were 2 things. Firstly, as to when the vaccine rollout would begin, and secondly, at what cost will the vaccine be made available. Now, Dr Harshvardhan there has said that the vaccine will be available for all Indians at a free of charge. Now, at this point of time, Siddhant, what are you picking up with the people that you're speaking there? Because the initial phase of the vaccination drive, when it begins, hopes to vaccinate 300 million people by the end of July. Any information at all about the way the government would be vetting people in terms of who will be given priority first to get the vaccines as and when they become available?
Well, India aims to vaccinate a significant number of people in the first phase, and the first phase, basically 3 categories are expected to be given the vaccine. The elderlies, the healthcare workers and the frontline workers. These are the 3 categories that are the focus areas, and then of course the other people or the other sectors of the society will be given the vaccine. But by and large, it is a massive program because we know that in several parts of the world the vaccination drive in fact has started, whether it's Israel, whether it's Europe, and the big focus of course is when India starts, because that is going to in a sense herald the process in the neighborhood, because a lot of countries in the neighborhood are looking towards New Delhi for vaccine, and many developing countries amidst the COVID crisis, we know that India has emerged as a pharma capital of the world, providing medicines to almost 150 countries. So the Indian vaccines will be used in many developing countries as well. So by and large, what India does is going to impact the world. And given the fact that India has had an experience when it comes to vaccination drive, when it comes to the polio vaccination drive, so India already has this infrastructure. The big focus is to fight any misconception. In fact, the Indian Health Minister, when he was here this morning, he talked about he would like to do away with any misconceptions that may have arrived when it comes to vaccination drive, because when it comes to the polio eradication program as well, there were misconceptions, and the Indian government particularly focused on that area. So there are multiple levels, multiple challenges, but here in India it will be a massive, mega and mammoth exercise when it comes to the vaccination drive.
Absolutely indeed, Siddhant. Thank you very much indeed for joining us and getting us all those insights. And this, of course, is the big breaking development that we are tracking at this point of time, where India's Health Minister, Dr Harshvardhan, has said that the vaccine will be available for all Indians free of charge. Let's listen in once again to what the Indian Health Minister said.
वैक्सीन जो है वो फ्री होगी लोगों के लिए या उन्हें कीमत देनी पड़ेगी? दिल्ली में जैसे फ्री है, दिल्ली में नहीं सारे देश में फ्री हो। वैक्सीन जो है वो फ्री होगी लोगों के लिए या उन्हें कीमत देनी पड़ेगी? दिल्ली में जैसे फ्री है, दिल्ली में नहीं सारे देश में फ्री हो। वैक्सीन जो है वो फ्री होगी लोगों के लिए या उन्हें कीमत देनी पड़ेगी? दिल्ली में जैसे फ्री है, दिल्ली में नहीं सारे देश में फ्री हो।
WION World is now available in your country. Download the app now and get all the news updates on the move.